Welcome back to the lecture of chronic liver disease in children. I'm Dr. Amel Elfaramawy, professor of pediatrics at Shams University. You know now from the previous segment that the pathogenesis of hepatomegaly in children may be due to inflammation, cholestasis, venous congestion, infiltration whether by benign cells or malignant cells, and storage disease of the liver. In this segment, I will explain glycogen storage disease, Gaucher disease, NiemannPick disease, and alpha-1 antitrypsin deficiency. Glycogen is stored normally in the liver, and its synthesis and degradation occur in a continuous cycle according to the blood sugar level. If it is high, the cycle will be towards synthesis, and if it is low, the cycle will be towards breakdown. This cycle is facilitated by many enzymes. Deficiency of any enzyme involved in this process will cause abnormal deposition of glycogen, which is called glycogen storage disease. It is an inherited metabolic disorder with more than 12 distinctive types affecting primarily the liver or primarily the muscles or both of them, as well as storage affecting other tissues. Clinically, there is growth retardation, doll-like face, huge hepatomegaly, and hypoglycemia manifested by tremors, irritability, hyperventilation, convulsions, paleness, and sweating. According to the type of glycogen storage disease, there will be other symptoms. As in case of type 1 glycogen storage, there is nephromegaly. In type 2 glycogen storage, there is cardiomyopathy and muscle myopathy. In type 4 glycogen storage, there is splenomegaly and portal hypertension. The diagnosis is based on the presence of fasting hypoglycemia. The liver biopsy shows the distended hepatocytes with glycogen with the nuclei pushed to the periphery and positive periodic acid sheaf stain. The enzyme deficiency can be demonstrated in the liver, leukocytes, erythrocytes, and fibroblasts. Genetic studies for the mutation analysis confirm the diagnosis. The goal of treatment of glycogen storage disease is to maintain normal blood glucose level. This may be done with continuous nasogastric drip feeding to enhance continuous feeding during the night in young infants, and frequent small feedings day and night with uncooked cornstarch that provides a steady, slow-release form of glucose. Liver transplantation can be done in selected cases. Lipid storage diseases are a family of diverse inherited metabolic disorders in which there is abnormal storage of glycosphingolipids due to enzyme deficiency. Storage can occur in multiple systems, leading to hepatomegaly, splenomegaly, skeletal abnormalities, bone marrow dysfunction, pulmonary infiltration, and neurodegenerative disease. Symptoms depend on the underlying enzymatic deficiency and the particular substance that is accumulating. In Gaucher's disease, there is accumulation of glucocerebroside due to defect in glucocerebrosidase enzyme. There are three types of Gaucher's disease. Type 1, the most common form, causes hepatosplenomegaly. It doesn't involve the brain, affects both children and adults. Type 2 is an acute infantile neurogenic form. It is usually fatal by the age of 2. Type 3 is a chronic neurogenic form, causes hepatosplenomegaly and slow brain involvement. Clinically, there is growth retardation, hepatomegaly, and marked splenomegaly, pancytopenia due to bone marrow infiltration, bone pains and fractures due to skeletal involvement, neurodegenerative symptoms in neurogenic types in the form of spastic convulsions, difficulty in swallowing, and mental retardation. Diagnosis is based on the presence of Gaucher cells in bone marrow and in the liver biopsy. Low enzyme level in enzyme assay. Genetic testing for mutation in the sequencing of glucocerebrosidase enzyme. Treatment is available by glucocerebrosidase enzyme replacement, symptomatic treatment for the anemia and growth retardation, and bone marrow transplantation for selected cases. NiemannPick disease is a lipid storage disease in which there is accumulation of sphingomyelin due to sphingomyelinase enzyme deficiency. It is inherited as autosomal recessive. Type A NiemannPick, characterized by hepatosplenomegaly, progressive neurodegenerative course, usually fatal by the age of 2. In type B, there is only hepatosplenomegaly, characterized by slow progression and longer survival. Type C is a chronic neuronopathic form. There is no enzyme replacement till now for NiemannPick disease. The treatment is just symptomatic. Alpha-1 antitrypsin is a protein synthesized by the liver and serves to inhibit protease enzyme and prevent it from attacking various tissues in the body. Alpha-1 antitrypsin deficiency is genetically inherited disease. The genetic defect alters the configuration of the alpha-1 antitrypsin molecule and prevents its release from the hepatocytes, so it will be stored in the liver, causing hepatomegaly and liver cirrhosis and portal hypertension. It will not also reach the lungs, so there will be lung tissue damage causing emphysema. The diagnosis is based on the presence of low serum alpha-1 antitrypsin level and the genetic studies for the gene mutation. As regards the treatment, there is no definitive treatment for alpha-1 antitrypsin deficiency, just symptomatic treatment for the chest condition and liver transplantation. Well, this is the end of this segment. In the next segment, you will learn about liver cirrhosis and its complications.